Hey everybody, I'm Christy Rogers. I'm part of Group 5, and we're going to be talking about health effects on Houston area oil refinery workers. General information. Southeast Texas is home to the most oil refinery and petrochemical plants in the United States. There are 10 in the Houston area. These include Valero, Total Energies, Lindell, Basel, Houston, and more. They alone can process 2.6 million barrels of crude oil per calendar day. When used at some refineries, oil and gas emit a harmful substance known as CO2. What's in the air? Five of the refineries listed in the graph on the right are located in Texas. The graph on the right shows refineries that exceeded limits on benzene, which is a cancer-causing pollutant. The threshold is 9.0 micrograms per cubic meter, and it shows, like, for example, one in Galveston Bay had levels of like 19. So, yeah. But data also shows that for some of these refineries, the benzene levels are increasing every year. Some challenges and risks that workers face are fires, explosions, acid-related incidents, air pollution, and increased health risks. Worker health risks include mesothelioma, skin melanoma, multiple myeloma, cancers of the prostate and urinary or bladder, asbestos in the past, and asbestos exposure put workers at risk for lung cancer, mesothelioma, and asbestosis. First, we're going to talk about mesothelioma. It's a type of cancer found in the thin layer of tissue that covers the majority of your internal organs. Most often affects the tissue that surrounds the lungs, plural. This type is called pleural mesothelioma. 96 to 100% of cases are caused by asbestos, while asbestos also causes 42 to 49% of lung cancer. Some common symptoms of mesothelioma include persistent cough, difficulty swallowing, pain in the shoulder, chest or lower back, bloating or abdominal pain, unexplained weight loss, night sweats, swelling of the face or arms. Some treatments. Mesothelioma can be hard to treat due to there's not many trials have been done and the nature of the cancer itself. And some treatments include surgery, palliative procedures, radiation, chemotherapy, immunotherapy, and targeted therapy. And current research right now is new immunotherapy drugs, combinations of immunotherapy and chemotherapy, novel ways of using the chemical therapy drugs we do know about, and researchers are also working on new diagnostic techniques and genetic studies of mutations that may cause mesothelioma.
Hello, my name is Robert Stallnicker, part of Group 5. First, to start off, we got multiple myeloma. Multiple myeloma is a cancer that forms in a type of white blood cells called a plasma cell. Healthy plasma cells help you fight infections by making antibodies that recognize and attack germs. The symptoms of this are bone pain, nausea, constipation, loss of appetite, mental fogginess, fatigue, frequent infections, weight loss, weakness, or excessive thirst. The current research for this entails, I found that bone marrow support tissues and bone cells produce growth factors that increase the growth of myeloma cells. In turn, these cells produce substances that cause bone cells to undergo changes that weaken the bones. These discoveries are helping researchers develop new drugs to block these growth factors, slow down the cancer, and reduce bone destruction. Moving on to melanoma. This is the most serious type of skin cancer. It develops in the cells that produce melanin, or ragged, notched, or blurred. The color is not the same all over and may The current research towards this has identified a number of molecular pathways in activated or mutated genes in melanoma. Clinical trials are testing new drugs to inhibit the MAP kinase pathway and other pathways that melanoma might use to grow and spread. Improving palliative care or supportive care is also part of this research. Research is also being done on vaccines, adoptive cell therapy, CAR T therapy, and T cell receptor therapy.
Hello, my name is Itai Ramirez from Group 5, and today I'm going to be talking about the health risks of local Houston communities. First thing I'm going to talk about is about the CO2 pollution and emissions that are given off by refineries effect in local residents, as well that there's a dramatic increase in children dealing with asthma attacks, and as well as children having lost school days due to the oil and gases from smogs. And some heads up, I apologize. I have dyslexia, so my words are gonna get messed up. Sorry about that. And the next thing I'm gonna say is about the threat radius. The Earth workers released an oil and gas threat map that shows that at least 116 counties in Texas are at the greatest risk of developing cancer due to having nearby refineries and a large increase of the CO2 emissions near them, close to them. And the next thing is the childhood asthma. There is, in the lung and airway becomes that easily inflamed when exposed to a certain trigger. The childhood asthma can cause daily symptoms that interferes with play, sports, school, and sleep as well. In some children, unmanaged asthma can cause dangerous asthma attacks, and some conditions, which is horrifying, can cause an emergency visit to the ER, the hospitalization, or even missed school days. Some symptoms and treatments. Symptoms include frequent coughing that worsens when the child has the viral infection, occurs while your child is asleep or triggered by exercise or the cold air. The whistling or wheezing sound when breathing out shortens the breath, the chest congestions or tightens. Some childhood asthma treatments. The long-term medication inhales about the corticosteroids, the leukotriene modifiers, the combination inhalers, the theophylline, the immunomodulatory agents. The quick relief medications or rescue meds are the short-acting beta agonists, the oral intravenous corticosteroids. I'm sorry about that. Some current research about asthma is how ventilators may lead to asthma, why medication works, personalization medicine, and some current research on medication, the airway cells and asthma, the bacteria in the airway, the target treatment for severe asthma. As well, what can be done? Workers follow safety program. The Lindo Basin has won more than 13 national awards, as well as the Valero received in the year 2021 the HFPM Safety Achievement Award recipient. There has also been no recordable injuries in 2021. Valero has participated with the OSHA Voluntary Protection Program for the highest of safety workplace program, also honored by the Houston Area Safety Council for outstanding safety. I'm sorry about that. And as well, these are some sources that my group used. You can check on that. And I would like to say thank you as well for listening. Once again, my name is Itai Ramirez from Group 5. Thank you.